started. And we'll record the meeting just for reference. We can send it out in case you need to hop off early or for folks that weren't able to attend this morning. We have an action-packed meeting for everyone. Next slide. If you haven't already, please go ahead and type your name and organization into the chat box and just introduce who is on the call. Next slide. This is the vision and mission for the Ohio Alliance. If you are a new partner joining with us today. Hi, everyone. Good to see all of the names in the chat box. Next slide. And this is the Ohio Alliance team. So you have myself, Reem Ali with you, Rachel Schilling, our program manager, and Bibiana Lagos, our operations manager. Next slide. So we're going to start off with some state policy updates, and then we will go into the connections between criminal justice and health and impacts on children and families. So a really great presentation from the Health Policy Institute of Ohio that is going to be shared out. And then we'll end with some Ohio Alliance updates. Next slide. And these are our objectives for today's meeting. So we want to make sure that you have some information on state policy issues or state budget issues and kind of the lay of the land in the legislature right now. Have an understanding of the impacts of parental incarceration on children's health and well-being and strategies that can support children and families and address or mitigate some of those impacts. And then be aware of Ohio Alliance upcoming events and initiatives. Next slide. As always, we encourage participation in our quarterly meeting and other calls. So please feel free to raise your hand if you have a question, or you can chat in the chat box. And there'll be a couple of opportunities, particularly after our guest speakers present, for you to ask some questions. Next slide. All right, well, it is my great privilege to introduce our next two speakers. Next slide, you can see who they are. So we have joining us today Mike Ditto, who is a partner with Highbridge Consulting. Mike served for 15 years in the Ohio House of Representatives, where he was a director of communications and then later served as chief of staff. He was also the first executive director of the Ohio House Republican Organizational Committee, managed several U.S. Congress primaries, and is a graduate of Miami University and then also the University of Dayton, as well as the George Washington University in D.C. And then also Patrick Schwartz. Patrick has over a decade of experience in policy communications and political work with Highbridge Consulting. And most recently, Patrick served the members of Leading Age Ohio for 4 years, where he served as Director of Strategic Communications, and then later as the Director of Government Affairs and Communications. He has led government affairs and political work for Leading Age Ohio in the past. And prior to that, also served 7 years in the Ohio House of Representatives Majority Caucus. He is an alum of The Ohio State University. So without further ado, I'll turn it over to Mike and Patrick, who will give us some state policy updates.
This is Patrick. Thank you so much for that introduction, Reem. Mike, I guess we don't really have to introduce ourselves. Reem did a really great job of that.
That's right.
So we can just kind of dive right in. We are with Highbridge Consulting, contracted to support the School-Based Health Alliance in their policy work at the State House. It's been a pleasure to work with Reem and the team through the budget process and then through this year. And we are excited to be with you today to provide a little bit of a state policy update. So I think we're going to tag team this thing and we can go on to the next slide, get things started. So I'll provide a quick update on some of the pieces relevant to the School-Based Health Alliance on what actually happened in the previous operating budget, House Bill 33. We were brought on, I think, midway through the House process, and at that point in the governor's budget proposal, he included for the first time direct funding for school-based health centers. Reem did a fantastic job of laying the groundwork in the House on that piece. And when the House passed its version of the state budget, it did include $15 million over the course of the biennium for school-based health centers. Once we were brought on kind of towards the end of that process, and then when the bill went over to the Senate was very much in a cutting mode this budget go around and stripped out, I think, about $1 billion worth of different funding priorities for everything from direct funding to different nonprofits and health services to some really major pieces that were removed. Unfortunately, during that process, one of the things that was struck, despite some hard advocacy work on our end and with Reem and the team, was the school-based health center funding that was included by the governor and the House. We were at that point had built a kind of good, strong coalition of key supporters, really in a few folks on the Senate side, and then one on the House in Senator Terry Johnson from Southern Ohio. If you know Senator Johnson, he is a physician and actually has experience in starting up a school-based health center in one of the school districts in his Senate district that he serves. Another member that kind of became a key supporter was Senator Teresa Gavarone, who has a few school-based health centers in her district. And then the other one is Representative Jay Edwards, chairman of the House Finance Committee, has school-based health centers in Nelsonville and other school districts in his district. And really, once this was removed by the Senate, I think it happened kind of at the top level and without a lot of input from folks like Senator Johnson and Senator Gavarone. We were able to galvanize these three, who then helped us kind of galvanize some of their colleagues to get this funding put back in. And we were very pleased when the conference report came out and we saw the amendments go through that we were successful in having school-based health center funding put back into the bill. I think the confusion, maybe not confusion, but the thought among the leaders in the finance committee on the Senate side was that with so much money for student wellness and success funds in this budget, why do school-based health centers need direct funding? And what we and Reem worked really hard to communicate is that there's no precedent for that funding in student wellness and success funds going to school-based health centers. And really, without a direct line of funding in the budget, it's possible they wouldn't get any of that funding. And that message did resonate, particularly with the folks listed there and others who have school-based health centers in their district. A pretty large coalition came together to advocate for it getting back in the budget, and we were very pleased when that conference report came out that it was put back in. So that was kind of the key piece as it relates to school-based health centers, was getting that funding put back in after its removal by the Senate. That sets a good precedent going forward, that it was something that's in the budget. It's always easier to advocate for something the next go around when it was already included in an operating budget. It kind of increases legislators' with something and helps you advocate the next go around. Another few pieces I'll touch on was the inclusion of student wellness and success funds in this budget, but with a little bit of a caveat this time that it requires districts and schools to spend at least 50% of the funding on either physical or mental health-based initiatives or a combination of both. So that was a little bit of a change in how those funds are allocated to this budget. Another piece that was certainly a talked about issue in the budget process and had very fervent opinions on both sides was the Department of Education being renamed to the Department of Education and Workforce and becoming a cabinet level agency that reports directly to the governor of Ohio. What this did, in essence, is take the powers and duties of the State Board of Education and transfer them to this new state agency. Really, this took wording from Senate Bill 1, which was a very contentious bill to strip most of the powers from the state board. A lot of people were blaming the state board for holding up, good policy due to all the bureaucracy over there and transferring them directly to a governor-appointed cabinet position. This was something that both chambers did give their blessing to and was included in the final budget bill. Another piece, something new that came out of this budget was the creation of the Department of Children and Youth to provide services to children and their families in the areas of prevention, early education, and support. This was a priority of Governor DeWine, who's, his entire tenure so far, he has made providing more supports for children in the areas of health, education, and really everything they need to succeed a priority, and so much so that he wanted to create a new state agency to oversee this. So that was in the budget as well. The budget also continued the phase in of the previous budget's fair school funding plan, funding schools at over $8 billion in each fiscal year. This was the what was known anecdotally as the Cupp-Patterson funding plan from a few General Assemblies back. Former Speaker Bob Cupp and former Representative John Patterson got together and put together a new school funding formula that really seeks to, emphasize equity in the school system, make sure there's student access to resources. It treats charter schools and private schools a little bit differently than previous school funding formulas, and this was continued in this budget. The House Bill 33 also made the Ed Choice Expansion Scholarship universally available to every Ohio student. This allows students from designated public schools the opportunity to attend participating private schools. This was another semi-contentious issue that was included in the budget. It provides students, K through 12 scholarship opportunities based on their household income level. Another piece of the budget, I mentioned earlier that the Senate had a very cut friendly viewpoint going into this budget process. Originally, they pulled out about $1 billion worth of earmarks and wanted to designate it into a separate fund, they wanted to make expenses using GRF revenues from a good tax year to support worthy projects around the state, but they weren't ready to just, go with all the earmarks that the House had in their version of the budget. So they pulled out $1 billion and created a one-time strategic community investment fund. Through the conference committee process, about $300 million of that billion was put back into the operating budget. We were very grateful to be one of those pieces that was put back into the operating budget, but there was still $700 million, that says billion, it should be million, in this one-time strategic. I wish it was 700 billion, that would be great, but it's 700 million into the one-time strategic community investment fund, which I'm going to touch on here shortly, is going to be allocated over the next probably 6 months as part of the capital budget process. So with that, I think we can go on to the next slide. So Mike, I think is going to give you an update of what's been going on at the State House since the budget.
Yeah, thanks, Patrick. And good summary there. And really, this is kind of a unique and a little bit of an unprecedented time in the legislature right now. As you have seen potentially in the news over the last couple of days, the House and the Senate are pretty divided on a number of policy issues, and there are a significantly reduced number of session dates as a result. As you've probably seen, the Senate is sort of churning out policy initiatives and passing bills, sending them over to the House. The House is sort of slower than that and has been lately because there's a little bit of a division within the majority caucus, and there seems to be no real effort to get along, if you will, at this time between the members of the House, at least. When Patrick and I worked in the legislature, there were usually somewhere between, I would say, 15 to 25 session dates scheduled from January 1st of the odd numbered year until June 30th before they broke for the summer recess before the 2000 whatever elections. In this General Assembly, the House released their schedule first, and they only have 7 scheduled session dates between January 1st and the end of June. They have no sessions scheduled in February. They have none scheduled in March. And a lot of them are sort of backloaded through April, May, and June. And we think that most of that focus will be around the state capital budget and the one-time strategic investment fund that Patrick mentioned. Yesterday, there was a lot of activity at the State House pertaining to making changes to issue 2, the initiated statute that legalized recreational marijuana. As you know, the voters approved that 56 or 57 by 56 or 57% of the vote. But the legislature has the ability to make changes to that because it is not a constitutional amendment. It is an initiated statute. So because of those dynamics happening right now, the House and the Senate are on different wavelengths about what changes should be made to the tax structure with recreational marijuana versus where those funds should go. There's a provision in the passage of issue 2 that allows for the home grow of marijuana. So that's a contentious issue as well. It appears from what we've been seeing and talking to members about that the governor's office and the Senate are very closely aligned on what they want to do. And the House is sort of still trying to figure that out. They have session today, and I think they're trying to work through some of those things. So there's a lot of kind of tense dynamics at the State House right now, unfortunately. And one of the things that's going to be coming up in 2024 is there's going to be an effort to change the state's redistricting process. Rather than have a redistricting commission that we've had this most recent time to draw the maps for the legislature, there is a constitutional amendment that will be decided by the voters next November that will allow for a so-called independent redistricting commission to draw the lines instead. This has caught some people a little off guard because sometimes the redistricting process can be a little bit messy. But the one that just happened a couple of months ago, back in September, you had Republicans and Democrats coming together to unanimously pass a bipartisan set of maps for the Ohio House and the Ohio Senate. So we will see what happens with that, but that's going to be a source of intrigue, I think, over the next year as another constitutional amendment will be before the voters next November. We talked a little bit about, as you see here on the slide, the ballot issues. Certainly you had the one issue 1 dealing with enshrining abortion rights in the state constitution. There's going to be some unwinding of state law based on that passage that we'll see what happens here over the next several months. And then we talked a little bit about issue 2. The other sort of kind of item hanging out there in 2024 and 2025 is the selection of a House leader. As you know, as you may know, Jason Stephens was elected the Speaker of the House, but he was elected with a minority of Republican votes. About a third of the Republican caucus supported him, and all of the Democrats supported him. So the 2/3 majority of the majority caucus did not elect the speaker, and that's been a cause of contention really for the last year. So there's been a number of House members, those incoming and those that are currently in the General Assembly and are expected to be there, that are still trying to make changes and saying that it should be the majority of the majority caucus that selects the speaker, not the minority. So they have been in apparently real discussions about selecting a new House Speaker in 2025. That remains to be seen if that will happen, but that does lead to some fractured feelings and just actions and factions in the House going into this next session. Patrick and I both believe that in 2024, that this is probably that whole issue plus the existing dynamics already in the House are going to lead to some probably some tense conversations and maybe some slowdown of some legislative initiatives as a result, but we'll see and we'll stay on top of it. And as Patrick mentioned, really the big thing that they're working on now is the capital budget. This capital budget also unprecedented with extra money coming in for the first time in a long time. And that will take up the lion's share of their time, we believe, over the next 6 months. Patrick, back to you.
Next slide, please. So the capital budget and the one-time strategic investment fund process, I'll give you an overview here of what that is going to look like. A typical capital budget really is I don't know if it's a smooth process, but it usually is a little different than what we're seeing now. You will have, you kind of make your case to both the House member and the senator for your specific district of where the project is. They kind of come together and agree on what projects they're going to support. A bill is introduced, quickly passes, and then goes into effect. This time, with the addition of, once again, I put billion instead of million, the addition of 700 million in one-time strategic investment funds, there is more disagreement on what that's going to look like. Because there is, they're playing with a lot more funds than they have in the past, which is a good thing if you're making requests. Now that there are a lot of groups that are making requests right now. And certainly it requires a lot of advocacy to be a part of that process, but they do have more funds this time around, which is great. Like Mike mentioned, the two chambers are not really on the same page on process, and they've released different due dates for submissions for consideration in the capital budget and strategic investment funds. The House due date for submissions is going to be December 18th of this year. Those are going to be due to the legislators that cover the area of the proposal, as well as to the House Finance Chairman's office, Jay Edwards. And then that will start the process of their consideration in the House bill. The Senate, their due date is not until April 8th of 2024. It depends on who you talk to. Some are asking for submissions sooner than that, but that is the official deadline on the Senate side for their submission. So really what we don't know is, let's say you make a submission before December 18th. We don't know how quickly the House is going to process those and turn that around, and whether it's going to be its own bill, whether they're going to release a list, that remains to be seen. If I were to bet, I would say we'll see something in late January, early February that will start the process of debating what stays in, what comes out, and what new things come in on the Senate side. And then the Senate due date will be April 8th. And then another just shot in the dark here my guess would be by the end of April, early May, we'll know what's in the Senate bill, and then there'll be either a conference committee process or something similar to what we see in the budget, where the two chambers fix the differences in the bill. That's the process as we understand it right now and what we expect, and certainly that is subject to change. We can go on to the next slide. And I think, Mike, there's one more little piece, just a little bit of a political update on, who we expect to be the next Senate president, and just a few folks that are term limited.
Yeah, absolutely. Thanks, Patrick. One of the nice things about the Senate is they often pick their incoming leaders early, or at least have a pretty good idea of who is going to be in leadership. And often they pick from the existing members of Senate leadership. So as you may know, President Matt Huffman is term limited from the state Senate in 2024. He will be seeking election to the Ohio House, which is where he served for 8 years prior to going to the Senate for 8 years. So he is expected to return there. And Senate Majority Leader Rob McCauley is likely expected to be the new Senate president. His leadership team has certainly not been announced yet. We're still a year away, but all the prognosticators certainly believe that he is most likely going to be the next person in charge of the state Senate. Rob only has in the state Senate. He was appointed in 2017 and then won election outright shortly thereafter. So he will be termed out in 2026 and will only be able to serve for 2 years as Senate president. But I certainly expect that he has the most likely ascension to that spot here coming up soon. Anything else you wanted me to cover, Patrick?
I just think the only other piece is that both the finance chairmans, Jay Edwards on the House and Matt Dolan on the Senate, are term limited as well. So we will see new chairs of the finance committees going into the next budget. And I think that wraps up our update. I'm happy to answer any questions or just thank you all for the time today.
I'm just going to pause here. If you have any questions, you can either type them into the chat box or you can raise your virtual hand and we'll call on you as you're thinking of questions. I think one of the things that we're really fortunate that we're going to be continuing to partner with Patrick and Mike as we are thinking about, I mean, I know that we just talked about the last state budget, but we are also forward thinking about the next state budget. And a lot of that work really starts to begin in the summer of 2024, believe it or not. And so we're going to be laying the groundwork to try to ensure continued funding for school-based health centers moving forward. Any questions from our partners? Right. Well, thank you so much, Mike and Patrick. We are so grateful for your partnership and appreciate those policy updates.
Thank you for the opportunity. We appreciate it as well.
All right. Well, we have Sarah Haig from the Department of Health who would like to share an announcement regarding school-based health center funding.
I was going to say good morning. It's almost noon. Thanks for letting us jump on. I can't share a whole lot of information other than we have a new solicitation that was just posted. This is for continuing operational support for school-based health centers. So this particular solicitation is only available to agencies that were previously funded throughout the ARPA project. However, I will note that we have 2 additional solicitations that we anticipate will be posted soon. So we will make sure to share that with Reem when they are available. If you go to the websites where this is posted on ODH's website, and I can put the link in the chat, there's a way for you to subscribe so that you're notified when funding opportunities are available. So you could also do that way to make sure that you have or you would receive notification when any additional solicitations are posted. Unfortunately, we're not able to answer questions about this since it is a competitive solicitation. There are FAQs posted on this website, and then there is also information on how to ask questions. So they have to go through our contracts or procurement unit, any questions. So questions would be answered and then posted for anybody to be able to see what the question and what the answer are there. So, and then here's the information about due dates. Thank you.
Thanks for sharing, Sarah. So this is exciting. This will be one of 3 funding opportunities for school-based health centers tied to the $15 million that was in the state fiscal year 24 and 25 budget. You can see here the inquiry dates. So you have from today through December 22nd to ask questions, and that does need to be submitted via email to the email address that you see on your screen. And then the final or all, I guess, applications are due on Wednesday, January 3rd of next year. I can't believe we're already at the end of 2023, but in 2024 by 4 p.m. And then there are 2 other, as Sarah shared, funding opportunities that will be available for school-based health center funding. Thank you, Sarah, so much, and to the ODH team for their hard work in putting this out. It is a feat to try to get everything together, and we appreciate their work and leadership in doing that. Next slide. All right, our next presentation is going to be on the connections between criminal justice and health, specifically the impacts of parental incarceration on children and families. So I'd like to introduce our next 2 presenters. So we have with us Jacob Santiago, who is the Policy and Evaluation Specialist at the Health Policy Institute of Ohio. And he manages work related to policy and program evaluation and leads HPIO's internal evaluation efforts. He has been with HPIO since 2020, and I had the fortune of working with Jacob and our next presenter, Haley Aka, during my time at the Health Policy Institute of Ohio. So also joining us is Haley Aka, who is the Vice President of Operations and Strategy at HPIO, where she manages daily operations and ensures the organization's implementation of their strategic plan and also serves as in-house legal counsel. Haley has been with the organization since 2015, and they are both alums of The Ohio State University. So let me hand it off now to my colleagues, Jacob and Haley.
It's so good to be with you, Reem and team. Thanks for inviting us. We're so happy to join you today and share a little bit about the work that we've recently completed on the connections between criminal justice and health as it applies to children and families. Next slide. If you're new to HPIO, we are an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending. I hope you all are eating lunch, taking a stretch, doing what you need to do to take care of yourself as we dive in and really consider this work together. I'm going to start here with this pie graph that describes the modifiable factors that influence our health. When we think about our health, a lot of us think about our access to clinical care. That makes up about 20% of the impact on our health. Others think about our health behaviors, right? How we eat and move and treat our bodies. We see here that makes up about 30% of the influence on our health. But on that dark blue left side, we see that 50% of the influence on our health comes from our social, economic, and physical environments, right? This is the conditions of our communities, our housing, transportation, employment opportunities, as well as any experience we might have with the criminal justice system. So in order to improve health, which is the goal for many of us, we need to pay attention to all of these factors, including the communities that we live in and the policies, systems, and structures that give people a fair chance at a healthy life. Next slide. So today we're going to explore some of the connections between criminal justice and health. We see sort of a broad framework for that laid out on this slide. Here we see that poor health, including mental health challenges, can lead to arrest and incarceration. Involvement in the justice system can lead to poor health outcomes like infectious and chronic diseases. And at the foundation, racism and poor community conditions hinder opportunities for health and well-being across systems. We also know that engagement with the justice system impacts health, safety, and well-being at all levels of society. So certainly incarcerated individuals are impacted, but so are their families and their communities, which is what we're going to focus on today. Next slide. HPIO has been exploring these connections for a while, and today we're here to share our fourth brief in the series with you. So for more information on these broad connections, you can see our very first brief that came out in 2021, that overview brief on the left here. We've also produced work on the barriers to justice for people of color. Last year, we conducted research on pretrial incarceration in the money bail system. And today, as I've mentioned, we're going to discuss our latest research, which focuses on the impact of parental justice involvement on children and families. Next slide. We selected this topic in a series of work because of the broad interest and support child-focused initiatives have received from policymakers at the state level. You just heard about some of that from the presentation before. I'd also like to call out the ways that hospital partners have taken an interest in the justice involvement of families that they serve. That's been sort of a key factor in moving this work across too. So for example, here in Columbus, Nationwide Children's has conducted a line of research on parental incarceration and the health of their patients, which has been really informative and helpful as a partnership to educate policymakers on this issue. Next slide. Focusing on children is also necessary in order to end the generational cycle of justice involvement that we see in our communities and we observe in the research. Later in today's presentation, Jacob will walk through the ways that parental arrest and incarceration negatively impact kids. These kids experience increased risk in many areas, including worse educational outcomes, mental health outcomes, increased risk of substance use disorder. All of these risk factors increase the risk that that child will themselves become incarcerated in the future, perpetuating a cycle that keeps families and communities from achieving their full health potential. Right? These kids deserve a chance to break this cycle, and there are things that we can do to help. On the next slide, we see our 3 key findings from the brief. Jacob's going to walk through these in more detail. I'll just pause for a second on that. But first, I'm going to frame our discussion today with some brief information about child trauma and adverse childhood experiences. We'll see the header on the next slide for that, and then we can move right into the next slide. Thank you. So involvement in the criminal justice system is traumatic. It's traumatic for the individuals incarcerated, and it's traumatic for their families. Incarcerated parents experience traumatic events like negative encounters with law enforcement, lack of needed medical attention, separation from their children and families, communities. The incarceration of that parent then destabilizes families and exposes children to trauma, which, as we mentioned before, increases the likelihood that the next generation may be incarcerated in the future. On the next slide, we see an introduction to ACEs, which I know is a concept many of us are familiar with. These are a set of potentially traumatic events that occur during childhood. And there are many different types of ACEs, ranging from forms of abuse and neglect to household challenges. And exposure to ACEs can result in a variety of negative outcomes for kids as they age, right? From increased smoking to depression, lower educational attainment, unemployment, inability to afford healthcare. This ACEs pyramid provides a framework to explain how these risk factors influence poor health and well-being at all stages of life. Next slide. Additional research that we've conducted on ACEs indicates that the ACEs that we see circled here in red have the most significant health impacts. Incarceration of a household member is one of those ACEs. We see that in the middle column at the bottom. But also all of these red circled things, we could draw connections between justice involvement with a family and those ACEs, exposure to those ACEs. Next slide. This challenge is more common than we realize, I think. In 2021, 13% of adults in Ohio reported having had an incarcerated parent during their lifetime. 13%. And due to inequities in the criminal justice system, Ohioans of color are exposed to this ACE at a much higher rate. Here we see that Black, Hispanic, and other non-white Ohioans are almost twice as likely as white Ohioans to have had an incarcerated parent. These are challenging circumstances, and stakeholders across Ohio are poised to take action to make a difference to kids and families who are experiencing these challenges. So I'm going to pass it over to Jacob, who will walk through the key findings from the brief and get us to some of those next action steps.
Thank you, Haley, and thank you, Reem, for inviting us to join you. Good afternoon. It's great to be with you all today. As Haley said, I will be walking us through the key findings from this most recent criminal justice and health brief, starting here, focusing on the negative impacts of parental justice involvement on kids. Next slide. We'll start with those foundational drivers, why parents are involved in the system. Next slide, please. The conditions of our community, quality of housing, healthcare, and education, job availability and income, food access, and crime and violence in communities all shape our health and can affect criminal justice involvement. For example, people experiencing homelessness are more likely to become involved with the criminal justice system. Additionally, children need to grow up in communities free from crime and violence, meaning that our policy response to crime should also focus on preventing crimes before they happen by supporting individuals, families, and communities. Then on the next slide, we'll see the impact of historic and modern day policies and practices that have had racial bias baked into them over decades. And, as Haley alluded to, communities of color are more likely to interact with the criminal justice system and become involved in the system because of these policies. In 2021, for example, for every one white Ohioan that was incarcerated, 5.6 Black Ohioans were incarcerated. And this mirrors the data that Haley just shared, that this disparity is not new and is true for adults in our state, that their parents also experienced this incarceration disparity. Next slide. And if these racial disparities were eliminated, not only would 40% less Ohioans be incarcerated, resulting in savings of $638 million in corrections spending per year, but families would also not be destabilized by these racist criminal justice policies, meaning that kids could avoid many of the negative outcomes of having a parent involved in the system. Next slide. And now we will move through the system, starting with interactions with police. Next slide. Policing and surveillance, such as traffic stops and pedestrian police stops, often extend into and disrupt the lives of families, including referral to children's services. In 2015, 18% of investigated reports to child welfare agencies across the country originated through police surveillance. And policing, specifically the arrest of a parent, can be a traumatic experience for children who witness the arrest, negatively affecting their mental health. Next slide. Moving on to the impacts of a parent being in jail or prison. On the next slide, we see that there are upstream factors such as poverty and healthcare access, educational outcomes, and housing and family stability. These upstream factors are all negatively affected by a parent being incarcerated. Next slide. And there are also ways that parental incarceration impacts child health downstream, negatively affecting their mental and physical health, physical and behavioral development, and increasing substance use among kids, particularly tobacco use. Next slide. We include some impact examples in the brief to show the gravity of the environment. In 2022, 5,397 children in Ohio were removed from the home for reasons including parental incarceration. Interactions with children's services can increase when parents are involved in the justice system. And when children are removed from their home, they are often also removed from their community and support systems, including schools. And then on the next slide, we see that there are economic impacts of parental incarceration, including a reduced ability for families to afford health care. Next slide. And the outcomes that we've listed, especially poor mental health, drug use, exposure to abuse and neglect, and being placed out of the home, particularly in a group home setting, can all increase the risk of children becoming justice involved in the future, continuing that generational cycle of incarceration. Next slide. There are also impacts on health and well-being when parents are reentering and experiencing collateral sanctions. Next slide. Collateral sanctions, for those who don't know, are legal restrictions on the rights and privileges of people who have had contact with the criminal justice system, particularly conviction. Ohio has the third highest number of collateral sanctions in the country, only surpassed by Texas and California. Many of Ohio's sanctions focus on employment and licensing, ways for parents who have been incarcerated to financially support their children and families. The second key finding is on the next slide. It really focuses on what Ohio has done so far to support children and families. Next slide. As Mike and Patrick discussed, there has been a lot of policy change in Ohio related to children and families, even within this last budget cycle. And really what we've seen in Ohio is a lot of policy focus on supporting children and families and keeping families together. To better understand those changes, HPIO reviewed the Ohio Revised and Administrative Codes, state agency websites, and the last 3 state budgets. Simultaneously, we reviewed the evidence of what works to support children and families and paired that with what Ohio is doing. I'll pull out some examples here. The next slide, we see an example of family health and well-being. Trauma-informed schools are an example of an evidence-based practice for supporting children, particularly those that have been exposed to trauma. Trauma-informed schools implement a tiered approach to trauma, ranging from education on it to more intensive interactions for children who have been exposed to trauma. There's funding available for schools in Ohio, such as the Student Wellness and Success Funds and Disadvantaged Pupil Impact Aid, to implement mental health supports for children exposed to trauma and to work towards the schools becoming trauma-informed. On the next slide, see an example of a way for parents to be diverted from the system. The evidence really identifies crisis intervention teams and other pre-arrest diversion programs as a way of, again, diverting parents away from the system. Not only do we see these programs being implemented at the local level, the Northeast Ohio Medical University, or NeoMed, received a state grant to develop a training and technical assistance program to help local communities with implementation of these programs. And our last example is on the next slide and focuses on supporting parents re-entering their communities after incarceration, including reunifying families. Local reentry coalitions, a form of reentry programming, provide support services to those, again, reentering their communities, including job training and access to educational opportunities, which help parents be better able to support their families. In July of this year, 43 counties were being served by a reentry coalition, and the Department of Rehabilitation and Corrections has issued guidance on developing these coalitions. And the next slide lists some more policy changes that are described in more detail in the brief, including some major changes in the last, about 4 years. The big takeaway here is that the momentum we're seeing regarding children and families is cutting across both the legislature and state agencies. And we're seeing movement in the right direction for families who are or have been involved with the criminal justice system to have the supports they need to be stable and to thrive. And then the next slide has our third and last key finding, which focuses on ways to build on this momentum of the policy environment. There are actions stakeholders can take across the criminal justice spectrum to continue improving outcomes for children and families. Next slide. And when doing this work, we should also keep in mind ways of addressing the foundational drivers that can lead to parents becoming justice involved and supporting communities most at risk of justice involvement. These things can include prioritizing strategies that reduce disparities and address those foundational drivers, and then also engaging with and listening to the communities most at risk of criminal justice involvement. Next slide. When thinking about family health and well-being, policymakers can expand and support local implementation of Ohio Handle with Care, which notifies schools when a child has been exposed to trauma and adversity. The next slide. Thinking about policing practice, the Department of Public Safety can develop guidance for local law enforcement to protect children present at a parent's arrest from the trauma of witnessing the arrest. Next slide. In terms of ways of diverting parents away from the system, policymakers, including courts, can implement recommendations on intervention in lieu of conviction from the Supreme Court of Ohio's study report on some related legislation. Intervention in lieu of conviction offers court-ordered treatment and dismissal of all original charges upon successful completion of treatment, meaning that parents can stay with their children rather than being incarcerated. Then on the next slide, when parents are incarcerated, the Ohio Children of Incarcerated Parents Initiative, a partnership between the Department of Mental Health and Addiction Services, the Ohio University, and local communities, can leverage state and philanthropic dollars to evaluate and expand to related programs of the initiative that provide people who are incarcerated with skills building classes, including parenting skills, and allow children and family members to virtually join their incarcerated relative for some sessions of that program. And then lastly, on the next slide, we come back to reentry coalitions and how those initiatives can be further fostered by state and local partners. Again, these are just some examples of the policy options in the brief. Next slide. I believe Haley can drop a link to the whole brief in the chat, but that is available on our website. Just go to hbio.net. Then next slide. Thank you all again, and we will take some time for questions.
I think that obviously terrific presentation, both Jacob and Haley, as you think about for our school-based healthcare partners, how this applies. I think thinking about your own patient population and the children that you serve or the communities that you serve, and to what extent this might be impacting students, and what are some steps that you might be able to take to better understand how pervasive this is within the school-based healthcare population that you all are serving. Any questions for Haley and Jacob? And Haley did pop the link to the brief in the chat box. Oh, I think I heard somebody. Thanks, Christina. Christina also popped in some additional information on the Student Wellness and Success Funds and Disadvantaged Pupil Impact Aid. Mm-hmm. These are funds that can be utilized by school districts to support both behavioral health and physical health services. There was a requirement in the state budget that 50% of those funds are allocated to physical and behavioral health. And so as you think about the different supports that can be put in place, if you're a provider, thinking about what can you maybe partner with the school district that you're working with on to address some of the challenges that Jacob and Haley outlined. And if you're a school district partner, maybe how can you incorporate that, those types of interventions or additional interventions to aid trauma-informed care in your school? And could that potentially lead to a result in school-based health center implementation as well?
You just saw the report that Christina put into the chat about more about the Student Wellness and Success Funds and Disadvantaged Pupil Impact Aid. When we were pulling together this report, we saw that there was a lot of unspent funds, so thought that that was a really great avenue for you all and other partners in the state to leverage to address more so the impacts of experiencing trauma.
The final slide in our deck has Jacob and my and in our piece of the deck has Jacob and my contact information. If any of these policy options or next steps sort of spark for you, or you have additional questions about them, please feel free to reach out to us. We're happy to have additional conversation about any of the specifics of those, or if you would find a presentation like this helpful with some other folks more local to you, let us know. We're happy to discuss further.
Thank you so much, Haley and Jacob. And if you're not familiar with the Health Policy Institute of Ohio, I highly encourage you to reference them as a resource. They provide lots of data that can help you in your needs assessments or in your impact work. Thank you both so much for joining.
Thank you all.
Thank you.
All right, we're going to share some Ohio Alliance updates now and also engage you in some polling for upcoming work that we have planned. Next slide. Really quickly, I did want to mention this initiative that is being spearheaded, I think by and I think it's Oregon something, an organization outside of Ohio, but I think Broadband Ohio is facilitating, looking for 10 school districts that are interested in implementing school-based behavioral health telehealth services. So if you are a school partner that could be interested in this, or are a school-based healthcare provider partner and are thinking that this could be helpful in one of the school sites that you are providing services to, highly encourage you to explore this opportunity. Next slide. So sharing out some upcoming work that we have planned as the Ohio Alliance, we will over the upcoming year be establishing an advisory group that is focused on developing working definitions for what a school-based health center is, as well as other innovative school-based healthcare delivery models. As we think about funding in the future, it's going to be really important that we can clearly articulate as a state what we mean when we talk about school-based health centers, what are the parameters for a school-based health center, and then what are some of the other models that we are seeing across our state that deliver critical healthcare services in schools. That advisory group is going to be meeting 5 times over the course of the next 10 months to provide feedback on the state-level working definitions. And then that work will culminate in a report that will be presented to the state. Next slide. We will also be establishing a school and healthcare provider bidirectional data sharing advisory group. And that group is tasked with providing feedback on the development of recommendations for sharing data between school-based healthcare providers and schools. Some of that work has already been underway, but we are looking to expand this advisory group to be more inclusive of other school and healthcare provider partners that are working on bidirectional data sharing or that have interest in bidirectional data sharing. There will be 3 meetings of this advisory group that will occur between January to May of this upcoming year. So want to launch a quick poll. We just want to see who all on this call might be interested in participating on these advisory groups, or if you might have recommendations for individuals who can participate on an advisory group. And indicating interest does not necessarily mean that you will be able to participate on the advisory group, but we want to gather that interest now and then may reach out to you further with additional information. Give you a few more seconds to fill out this poll. This is a 2-part question, so please make sure that you're answering both question 1 and question 2. All right, terrific. We can go ahead and close out that poll. Thanks, Rachel. All right, next slide. Over the course of 2024, we are planning a webinar series offering continuing education opportunities for health professionals. So this will be an interprofessional continuing education opportunity for health professionals. We'll have a series of quarterly topic-specific trainings to build capacity for the delivery of high-quality, integrated, comprehensive school-based healthcare services. Those sessions will be about an hour to an hour and a half long, likely going to be kind of a lunch and learn situation, but would be a great opportunity for you to join in to earn continuing education credits for if you're a health professional or clinical professional for the work that you are doing and get some knowledge and build up some capacity around school-based healthcare services and delivery. So more to come on that soon, but just wanted to give you a preview of that upcoming series. Next slide. Our next bi-monthly school-based healthcare learning community meeting is going to happen towards the end of January, so January 25th of next month. This learning community is limited to school-based healthcare providers and education partners. So if you are not already registered for this learning community series, please go ahead and register. You will receive the calendar invite for 2024, and you will then be able to participate in those bi-monthly learning community meetings. It's a great way to, again, build up your capacity to deliver school-based healthcare services and connect with other partners from across the state. Our last bi-monthly learning community meeting happened just a week ago, and we were focused on the implementation of universal screenings. Next slide. I'm not quite sure what happened. There's a mark across the screen. I don't know if Rachel, you're able to delete that. But if you're not, it's okay. We'll just go with it. The registration is open for our 2024 Ohio Alliance School-Based Healthcare Conference. That the registration will remain open. I think Bibi maybe reminds me what the last date is, or pop it into the chat box, the last date for registration. And
December 20th, early bird.
December 20th, early bird rate.
On January 15th for the general admission.
15th. Thanks, Bibi. So you can access the early bird rate until December 20th, and then the ticket prices go up. So we encourage you to go ahead and register now. We are firming up the agenda. We will have breakout sessions that are focused on 3 tracks: equity and the social determinants of health. Comprehensive and integrated care is the second track. And then data innovations and technology-based solutions is the third track. And we'll be offering 3 to 4 sessions in each of those breakout tracks. Across 3 breakout tracks, I think we're going to have anywhere from 10 to 12 breakout track sessions, along with plenary speakers as well. So we, again, encourage you to register for the conference. If you have any questions, you can reach out to the Ohio Alliance team. Bibi is point on that, so she can really direct any questions that you might have. Next slide. All right, we are coming to a close, and we'll give you back about another 25 minutes in your day. But before you leave us, we do ask that you take a quick poll to see whether we met our learning objectives for today's quarterly call. You can take a second to fill out that poll. We are all about evaluation here at the Ohio Alliance, and so want to make sure that we met the objectives. If we did not, no feelings will be hurt. Please do answer honestly. We are always looking to improve on our work and our support of all of you. All right, I think we're almost at full participation. Thanks, Rachel. And next slide. Again, we always like to promote our social media. It's a good way to stay up to date on school-based health policy news and updates. So we are on LinkedIn, Twitter, Instagram, and also, if you're not already, please make sure that you signed up for our bi-weekly newsletter. And with that, I will wish you happy holidays and hope to see you again in the new year. And Andrea, just real quick, will you be sending additional information on the advisory groups and how to join? Yes, Andrea, they are going to be by invite only. So we're gathering kind of interest, and then we'll be firming up a stakeholder list for each of those advisory groups. But if you are interested, please do let us know. We'll be looking to those interested interested lists first, and then we'll be firming up to round out our advisory groups. Thank you so much, everyone. We'll hang out for just a little bit, the Ohio Alliance team, in case you have any questions for us. Again, hope you have a wonderful holiday season, and we look forward to seeing you in the new year.